Thank you for taking the time to view this video. It will help you get maximum benefit from the Saunders Cervical Traction Device. This video, along with a user's guide, will supplement any information you may receive from your healthcare provider or medical equipment dealer. The Saunders Cervical Traction Device requires no assembly, just remove from the case and it is ready for use. To prepare for treatment, place the device on a carpeted floor or other firm surface. Set the traction angle prescribed by your healthcare provider by squeezing and sliding the tabs on both sides of the angle adjuster until it locks into place. The angle adjuster positions are top 15 degrees, middle 20 degrees, bottom 25 degrees. If your healthcare provider did not specify the angle of pull, leave the angle adjuster in the top 15-degree position. Check to make sure the air hose is free of any kinks or not being compressed. Ensure the neck carriage is in its starting position by rotating the hand pump gauge to the release position. This allows the neck wedge assembly to slide down the track as far as it will go. Loosen the adjustable head strap on both sides and secure into position. Separate the neck wedges by rotating either of the black adjustment knobs so that your neck fits easily between the wedges. You can make additional adjustments after you lie down in the device. Do not over-rotate the adjustment knobs. This will result in damage to the internal gear. Place the pump nearby so it is accessible during treatment. Be sure to select a place where there is ample room for you to lie down in a comfortable position. Lie on your back, positioning your body so the neck wedges cradle the middle or narrowest part of your neck, and your neck rests comfortably on the head pad. Turn either of the black adjustment knobs until you feel the neck wedges positioned firmly against the sides of your neck. Secure the head strap on your forehead just over your eyebrows by using the hook and loop adjustment. This strap should fit comfortably and quite snug. Note the time or set a timer for the length of treatment. Now you're ready for treatment. Rotate the gauge to the pump position. While observing the gauge, begin slowly pumping air into the cylinder. The Saunders Cervical Traction Device features unique self-adjusting neck wedges that grasp and contour to the back of your head and neck. You may feel the neck wedges rotate as you apply more force. You can also rotate the wedges manually as needed for the most comfortable fit. After you have applied some traction, rotate the gauge to the hold position. Follow the treatment guidelines given by your healthcare provider. Before you continue pumping, remember to relax, taking several deep breaths, and let the Saunders Cervical Traction Device do the work for you. Now, rotate the gauge to pump and pump slowly until desired traction is reached. Then rotate the gauge to the hold position. Do not exceed the amount of traction prescribed by your healthcare provider. Traction should never cause pain. The device features a very accurate, sensitive gauge. The pump is specifically designed not to leak and reduce pressure in the hold position. If you notice a drop in the gauge reading when in the hold position, this is probably because you've relaxed or moved slightly. If this happens, return to the pump position and pump back to the desired force, then reset to hold. During the course of treatment, it is normal for a small loss of pressure by 10% due to the relaxation of your spine. If loss of pressure occurs, add pressure to maintain your prescribed force. The Saunders Cervical Traction Device has been designed not to exceed 50 pounds of traction. If you happen to exceed the poundage prescribed for you, let some air out of the system by rotating the gauge to the release position. Begin again by rotating the gauge to the pump position and pump slowly until you've reached the desired amount of traction. At this point, rotate the gauge to the hold position. If your healthcare provider instructed you to use intermittent traction, apply the pump, hold, release steps as instructed. Maintaining 25% of force during the rest cycle may reduce any discomfort you may experience. When your treatment is complete, rotate the gauge to the release position. Wait until all of the air has been released from the system, then loosen the black adjustment knobs to separate the neck wedges. You should rest and relax for a few moments, then remove your head strap. While still lying down on your back, move your head slightly up and down and side to side a few times. Slowly get out of the device. Thank you for watching this video and using the Saunders Cervical Traction Device. If you have any